So how can a faculty member or a program integrate Nursing Central into their own curriculum? First of all, make it an assigned part of your book list. If you are already incorporating a Tabor's drug guide, some kind of a lab book, some kind of a diagnostic, any kind of book, um, we already had those things as part of our book list. So you can make this part of that assigned book list as well, and do that in lieu of the hardback books. We have laptops available to our students. So much of learning today requires some kind of utilization of technology. Not every student comes into a program able to afford that technology. And so we also have laptops available. I had mentioned before, we have tablets. We had gotten a grant several years ago to have iPads, and we've also been able to update those iPads. So we got a new set a couple years back. And now, most recently, we got a set of laptops that are really replacing those iPads. And so just have something available for them to use. They also, almost everybody has their own phone, so this can be downloaded on their phone. So you have this as part of the book list to begin with, and something for them to download it on. And then during their student orientation, we take 2 days where we're orienting the students into our program. And so now that is also a part of the orientation, how to access, download, utilize those resources, how to use the serial number that they purchased to redeem those resources on their devices. And it's really important to have a faculty member who is really familiar and make that person the point person for your Nursing Central resources, so that the students have somebody that they can go to that can help them download or maybe reload, or maybe they bought a new phone and now, or a new tablet, and now they need to reload those resources. And how do they do that? And so having somebody available helps the students so that they're not getting frustrated, and also knowing who the contacts are for technical difficulties on Nursing Central. And then create this intentional use. So it's all well and good to say, this is our resource, this is one of the things that we use to help our students. If you're not integrating it throughout some of your curriculum to make it intentional as a go-to for them, some things are going to get lost. They're going to forget. And there's really relevant information that they can find. So take those point courses that are your difficult courses and create some intentional assignments for those. So I have some assignments in MedSurg 2. As I said, I teach that. And I also teach pharmacology. I have a research assignment for the students as well. And I teach maternity. And so there is some pretty good size, at least one exercise in each course that I use, that's a good weight of exercise and weight of grading that I have them go to Nursing Central to get those resources from. And then keep the faculty involved. So if there's just one person that's really excited about it, but nobody else is really doing that much with it, then you're only getting a part of the students, and you're only utilizing a part of what the potential is for this in your program. So keep all faculty involved, and that can include helping other faculty members with integrating those resources and or understanding what all the potential is by having this platform.